The Tri-County area will be moving into Phase 1B Group 7 starting next Monday. Now, this will come as many health officials are concerned about a spike over the Easter weekend.
We wanted to see where Clackamas County stands now. Joining us live is the county's health officer, Dr. Sarah Present, with an update. Good morning, doctor. Thanks for joining us.
Good morning. Thank you for having me.
So we've heard this warning now from various health officials this week, concerns as we head into the Easter weekend and the holiday here. What is the county doing to try and prevent this from turning into a real spike?
You know, I think every time we have a holiday in this last year, we've had to really talk about how things need to be different in order to keep everybody safe. In the last few months, we've had a big decrease in our case counts, and I think that as businesses reopen or increase capacity, as schools bring children back into the classrooms, as more people get vaccinated, there's a lot of hope. But we also may have a sense that other behaviors can start going back to normal. And unfortunately, if we do that, we really might see a big increase in cases again. In fact, in Clackamas, in the last couple of weeks, we have seen cases go back up again. And if we don't continue to take the precautions that we know we need to take, then we may need to decrease the increase the restrictions on businesses again, or we will potentially see more hospitalizations, more deaths, and more people with long-term debilitating disease.
No one wants
So
to
as
see
we go
that.
into a holiday where we normally like to gather with family and friends, we need to remember that this pandemic is not over, and we need to continue to do all that we can to keep each other safe.
Yeah, and of course, part of that is vaccinations. How is the vaccine rollout going in your county?
It's going very well. We are getting a lot more vaccine every week, and we are moving it in across the county and getting it to the people who need it. As we continue to get the vaccine and get it out to the people, I just ask that everybody be ready and be willing to get the vaccine when it's your turn. Even if you don't think you're at high risk, getting the vaccine will help your whole community get through this.
So we're seeing that vaccine supply increase, but of course next week your county moves into Group 7. Do you have enough vaccinators and vaccination sites ready to handle an increased pool of eligibility?
We have been working with many partners, our fire agencies, our pharmacies, our medical providers, and others. We have private businesses that we've been working with. We have lots of plans and people ready to get those shots into arms once we get them.
Okay. Do you know of any of breakthrough cases in your county, the cases where people have gotten the shot and then they end up getting COVID anyway?
We have had a few breakthrough cases, and I want to just be very clear that if you have a vaccine that's 99% effective against disease, that means that 1 out of 100 people might still get the disease after getting the vaccine. But that's an incredibly high efficacy rate, and it really, if everybody gets vaccinated, it will bring our numbers significantly down as a community. There will be people who still continue to get the disease after getting the shot, but they're very rare.
Yeah, not enough to discourage anyone from getting the vaccine. It's an important message there. Dr. Sarah Present, Clackamas County's health officer, thanks for joining us this morning.
Thank you so much.
And
Have a wonderful morning.
You as well. And of course, you can find all the latest coronavirus news and resources anytime on KOIN.com.
New this morning, the